Hello, Jonty.
Hello, Charlotte.
And how are you feeling?
Well, slightly better than I was last 2 days, because I had a wisdom tooth out, and it was not quite what it was difficult. Basically, it made my whole face numb.
Yeah, it's all
painful.
swollen.
Yeah,
here,
it's all swollen. Yeah, but it's a lot better than it was.
And you weren't really expecting it to happen. You just thought you were being checked up on, weren't you?
I thought I was going to go in there and they're going to ask me if it hurt, and I'd say no, and then I'd come back 6 months later. But the dentist in the hospital was very nice. She can't be more than 27, and she was very efficient, smashing away the tooth and getting rid of it and stuff.
And you had a stitch, didn't you?
And I had stitches in my gum, yeah.
Yeah, because they cut out.
A cyst, yeah, they cut a cyst out. It was a lot of I can cope.
And then you had to be careful what you ate.
Well, I didn't. Did I?
Yeah, you were, because there's certain things you couldn't have anything to eat or drink hot drink for ages.
Yes.
Did you?
No, I was. It wasn't fun, I should say, but it was well done, but not fun.
And how did you manage the pain?
Well, I tried to go to sleep in the afternoon of Thursday, but that didn't work. So I just carried on, but it made my head all swim, basically. Everything I couldn't speak. It was all problems. It was just a lot of pain everywhere, swollen face.
And did you try any of those sort of like numbing sensations, like imagining that it was numb?
No, I didn't actually. No, I didn't know about them until we were washing up today.
I had mentioned it in the past.
Right.
But you put Bonjela on it. And
I put Bonjela on it, and I took Nurofen.
Yeah. Now in hypnotherapy, there's a really good technique. It's using your imagination, and that is imagining the numb sensation, as if you're just being given another anaesthetic, anaesthetist injection, or like loads of ice cubes.
Yes.
Going on, not sensitive, but as in the numbing sensation that something cold can give you.
Well, to be perfectly honest, I was so messed up in the head in the afternoon that I felt horribly unwell.
I know.
So I wasn't thinking properly. It was, the Nurofen did the trick, and the paracetamol did the trick.
But it's a well-recognised technique that people can use if they've got pain to help relieve them from pain or manage pain.
Yeah.
Is to imagine they've got like a pain dial, and then they can turn the pain down, and that they've got some magic cream that feels like that numb sensation. Yes. And they can put that on.
Yeah, well, that's great now.
Yeah, well, it's to tell you in the future. Like there's one of the techniques is called glove anaesthesia, and that is you walk somebody through imagining that their hand is in a bucket full of ice cold water, and the numbing starts at your fingertips.
Yeah.
And we did that when I was studying hypnotherapy in class.
Yeah.
And then the teacher would come round and stick a pin in our hand, like a safety pin.
Yeah.
Just all the way through and close it, and we wouldn't feel anything.
Oh.
And some will do it on their cheek, and that's just proof of how our imagination can work to help not notice the pain. When you're focusing on something like relieving the pain or making it all numb in that area. So as I say, it's a well-known technique.
Well, as I said, I don't know if lots of people have had wisdom teeth out, but it didn't. It's not like a normal tooth.
No, it's a big one, isn't it?
It's a very painful operation, and I didn't feel well.
No.
That's what I didn't do, but I feel okay now.
I'm just counting how many days later.
That'll be 3, won't it?
Yes.
Yeah, 3 days later. 2 days to 3 days. I've been feeling good.
And what did I put you through yesterday?
What happened yesterday?
Well,
the Oddstock radio.
Yeah, so we had a busy day. So you're not feeling tickety-boo.
I wasn't feeling tickety-boo. We had to go and we
had a lovely time.
A lovely time for an hour at lunchtime yesterday doing Oddstock radio, which was very nice. We got all our favourite records and played them for them.
Yeah, we were asked about our podcast, and we were asked about the DJing that we're going to be doing in aid of the Salisbury Hospice at the chapel on the 20th of June. And we'd spent Friday night getting loads and loads of records together, which was like music therapy, wasn't it? Because you took,
I really rather enjoyed it.
It took the focus off your face, didn't it?
It was fun.
Yeah, and you didn't once talk about your jaw or anything. You just were just focused on doing the songs.
Yeah.
And that was really good. And we took more than enough records, didn't we?
Oh, much more than we needed.
Yeah, because
the one that I really want, hopefully Bob will get at some point, Viola Wills, Gonna Get Along Without You Now. I love, that's my new favourite record, that is.
Yeah, it's great. But playing music's very therapeutic, isn't it? And you're focused on which songs, the order to put them in.
That's right. I mean, I'm enjoying this, and we've got May, June. We've got 2 months basically before. Oh, crikey, isn't it?
Don't worry. But what I was going to say was to focus on. It takes your focus off of all the other things because you're just focusing on the music.
Yeah.
You're really getting into it.
Well,
And when we were talking at the Radio Oddstock, we hadn't anticipated that we'd be interviewed. We thought we were just playing some records, didn't we?
Yeah.
So that's where the time went quite quickly.
I'm just memorising records into my head so that I can DJ again, because I haven't DJed for 30 years, and I did it for 10 years before that, so I'm memorising records to do the job.
That's really good, really good.
That's what I'm doing. But we had at home, we had the war of the vaping. I'm not allowed to vape in the bedroom anymore. Or the kitchen, but I still have got the dining room and the sitting room to cope with. That's how it's going.
But when you've had like stitches in your mouth, vaping's not a very good idea.
No, that's why you was hurting me probably.
Yeah, and if also. Thinking about vaping, is it very good for you?
No, probably not. But occasionally nice. Nice. But I feel that we're going to lose the sitting room and the dining room at some point.
Well, let's go back to the music.
Yeah, okay.
Talking about the music, because we had a party last night for my son's 18th.
Oh yes, a lot of fun.
And we had lots of music. He put on his playlist, which is a lot of old songs anyway, which is really good. And then him and his friends were sat out in the courtyard. So my friends were in the dining room.
Yeah.
And I was doing some DJing, and you did some fab DJing.
Yeah, I did some.
We played some records. And I was chatting to Julian.
Yeah.
And he was talking to me about some research that University of Minnesota had done on, and when people learn to play music, how much it broadens their mind, like creates more creativity, increases the capacity in the brain to learn more. He was describing it as like child prodigy and things like that, because if you start to being more creative at a young age, you're growing more and more your brain at each time. And I think a lot of us, we will do like art and music while we're at school, when school makes it readily available for us. But as soon as we leave that environment at home, we don't bother. we don't bother to carry on doing a lot of creative stuff unless you really really are into it.
Yeah.
And when I work with some clients, and if I introduce something a bit creative, knowing that they are up for it, like drawing their body, for instance, once they start getting into it, they feel really therapeutic about it. They feel more connected.
Yeah. Well, music is therapy, isn't it?
Didn't you say that you tried to learn the piano once?
That was not a success. That was not good. Nick Wills tried to teach me, but not a success.
But it's like anything though, isn't it? The more effort you put into it and the regularity of it all, the more it becomes a habit, and the more it was easy, you less thought about it.
Yeah. Well, I mean, I don't want to try again. That was 50 years ago. Probably not something I'm good at.
I do singing lessons.
Yeah.
And I started doing... Well, do you know why I started doing singing lessons?
No.
No?
No.
So, to help... Well, one, I wanted to get more confident with my voice. And two, it would be really nice to be able to sing. And as long as you've got a voice and the willingness, then you can become a singer. But what I've realised is that by having singing lessons, it really has helped me with my confidence. It's helped me more with my presenting, my speaking. Because if I get out, like doing a stop, not worrying about making a mistake, as in, not thinking, oh my God, I just want the world to swallow me up. I've made a boo-boo. It's like you can get over yourself and you can move on and carry on presenting what you're going to present. Because most people don't notice the mistake until you point it out.
No.
But also, as I say, I find that my voice has improved. How you speak, the position of the words, because where you're doing singing, you're using different muscles. But yeah, it's really good. So I recommend that if somebody wants to become more of a, more confident presenter, by taking singing lessons, it really helps you. But again, it helps grow more neural pathways in your brain and creates more creativity.
Yeah.
Yeah.
Yeah, that'll work.
That's good.
I'm not singing.
No. I think you'd be quite a tenor though, wouldn't you?
I don't know what I'd be, but it's probably not going to happen, so we don't have to care about things like that.
Oh, that would be funny, Jonty. That would be funny.
I tried karaoke once, so it was not a success.
What song did you sing?
I can't remember.
Okay.
But it didn't work, probably.
Well, when I had a party for Donnie's 21st a couple of months ago, we did karaoke.
Yeah.
But you didn't join in.
Well, that's why.
And it was really good fun. I was hoping there was going to be karaoke last night, but they didn't get round to it. So,
yeah.
But yeah, so a quiet evening for me.
I mean, I might try singing at some point, but privately in a room.
Yeah, or in the car with me.
Well,
sing along in the car.
I might try it at some point, but not yet.
And you said that on camera, so that
would
be nice.
Work in progress.
Oh.
Get Dave to teach me how to sing.
Yeah, I'm sure he'd love that.
Yeah.
That'd be really good. So what have you got to look forward to this week?
This week, I think I'm being dunked in a barrel.
I didn't know that.
I thought you were talking...
on Saturday.
Saturday I'm being dunked in a barrel.
Oh, we're doing cold water.
Yes, there's
therapy.
Something going on with her friends, and I think I'm in a barrel.
That's right. Yeah, we're doing cold water therapy.
But apart from that, I've got a nice, easy week actually. Yeah. We've just been talking to Paul about it. The pub's going okay. Well, going really well actually, and I'm not having any stress. There's no I can cope going on in the pub.
That's
at
really
the moment.
Good. That's really, really good. I'm well pleased. And what we haven't mentioned is it was Pansey's birthday on Friday.
Pansey's birthday on Friday. Yeah, he got spoiled.
He was 5.
5 years old, Pansey.
The pub cat.
I'm looking forward to him coming here, actually.
Mm.
Because he can retire as well.
That'd be wonderful. So, I'm Charlotte Phillips, clinical hypnotherapist and NLP practitioner at What Is Your Story, hypnotherapy.co.uk.
And I'm Jonty Newbury, landlord of the Duke of York pub.
So do follow and subscribe on Icon Co Method on YouTube and on Facebook and in other places. Have a lovely week.
Have a lovely week. Bye-bye.